right? This is what comes to your mind, right? How many of y'all saw this movie? Right? No. One Flew Over the Cuckoo's Nest, right? One of the movies that really stigmatized mental illness. Forget ECT, right? But to start with just mental illness, psychiatric care in and of itself. And this is what I hear, right? When I tell them, hey, you're talking about ECT or shock treatment. Oh my God, do they even do this anymore? Right? How cruel can you be? Right? It's so barbaric. And like, why would you force somebody to like zap themselves? Right? None of these things are true, by the way. But there's a reason why people associate it with these words. Right? So let me give you all a brief background, right? Way back when, right? Decades and decades and decades ago, when we really did not have psychotropic medications, and we did not know what we can do with patients who are extremely psychotic or aggressive and violent when they're psychotic. They did not know what to do. And so and extremely depressed as well. So what they found out that people who have epilepsy and have depression, after they have a seizure or a convulsion, their depressive symptoms got a little bit better, right? And so the researchers at that time were like, we are probably on to something, right? They have a seizure, they have a convulsion, and they get better. So they tried to cause a convulsion artificially. So what were some of the things they started doing? They started injecting people with insulin, right? Ridiculous amounts of insulin to cause a seizure, right? But people who die, right? You're becoming extremely hypoglycemic, right? Or they would like lock somebody in a hot box, right? Hyperthermia, cause a seizure, people would die, right? I mean, very, very barbaric methods, right? That's why barbaric truly comes from there. And then with the advent of electricity, they were like, hey, let's just try electricity to cause a seizure. So you plug something in the socket, whatever current comes out, and zaps your brain, right? So again, very, very barbaric in a way, right? Whatever current comes out. And so that's why it has such a negative association or connotation. However, it is so significantly different now, right? With advances in physics, in advances in science and research, I control every single aspect of this ECT kind of current. The entire procedure lasts about a minute, if at that. People are under general anesthesia, you're asleep, so you don't know, right, what's even happening. And so the point of general anesthesia is like when people have a seizure or convulsion, right, they go like this, right? You bite your tongue, you void yourself, people break bones sometimes, right? The point of having general anesthesia and a muscle paralyzer is so that your body doesn't go like this, right? And you don't break your bones and you don't break your teeth, right? It's so the only way I know that you are actually having a seizure is through your brain waves. And I brought the ECT machine to kind of show you all that too, right? About how in depth we control this. It's really safe. And to give you all an idea, do we have any moms here? Any moms? ECT is safer than childbirth. There are more people who die in childbirth than from ECT. Safer than an appendectomy, if that kind of gives you an idea, right? That's how advanced things have actually become now, right? So I can talk and right, this is what you do, right? It's only with the consent. It's no longer forced. Do not do it in kids, right? Only adults, right? I have extremely rarely tried it in somebody who's 17 years old, but extremely catatonic, not responding to medications, extremely psychotic, not eating, not drinking for several weeks, right? At that point, then we would really consider that. But otherwise, we really wouldn't. Only in adults. So I just wanted to show you all a couple of videos. This one I want to show at the last. So I just wanted to show you this video, right? This video is kind of powerful. It kind of gives you all an in-depth understanding of what actually happens, because I want people to see what actually happens before I talk, because I can talk forever for people who know me. And so I think I just wanted to show this video so that you guys have an idea about what I'm talking about. Can you turn the lights on?
The brain is the most complex organ in the human body. It controls almost everything, but sometimes imbalances can disrupt normal function, causing any number of abnormalities and ailments, including mood disorders, such as depression. ECT is given to treat depression, and it is sometimes used to treat other mental illnesses like catatonia and bipolar disorder, when other treatments have not worked.
Electroconvulsive therapy involves delivering electricity to the brain to cause a generalized seizure. And then we do a series of seizures over 2 to 3 times per week over 2 to 4 weeks to treat the psychiatric condition that brought the patient to the treatment.
The idea that seizures would help depression came from observing people with epilepsy. It was observed that after an epileptic patient woke up from a seizure, the individual was much calmer, and their behavior was better controlled.
Essentially, it's the brain's response to its anticonvulsant or its anti-seizure effect may actually be the therapeutic element.
But what exactly is depression?
Depression is not simply being sad or having a bad day. Depression is a medical condition that is a combination of symptoms.
I would describe depression as having kind of a great big gray kind of over you. You feel very dull and heavy.
I was extremely tired a lot. I got increasingly bad tempered. It came on very quick and it was quite severe. I clearly was not myself.
My main problem was depression presenting as anxiety and nervous tension.
I didn't want to talk to people. I didn't want to hang out anymore. I really became withdrawn.
Depression is the primary mental illness that is treated with ECT. ECT is often recommended when antidepressant medications are not effective, or if they cause unacceptable side effects.
So it's often used in patients that have tried some of these other treatments and they haven't responded well. And so we might go to electroconvulsive therapy, ECT, to see if that will work for them.
ECT is also called for when a patient is dangerously suicidal and can't wait the 2 or 3 weeks to see if the medication will be effective.
Before I knew what was going on, I was threatening to kill myself. And I always get the doctor's attention. And my wife said to me at one stage, I think we ought to go to the emergency room.
Over the years, ECT has been improved and refined. The popular novel and movie, One Flew Over the Cuckoo's Nest, depicted ECT as painful and inhumane.
The difference is they used it in the movie as a punishment. Very different than the therapeutic version of ECT that we do today.
A therapy that is the best hope for many depressed people.
I really wanted something that would work quickly and effectively to get me back into my life again.
I was really not surprised when they brought up the suggestion.
Most patients that come in for ECT need anywhere from 6 to 12 treatments to get the full benefit. The number of treatments an individual patient might need is kind of dynamically determined based on how they're responding to the treatment. And some patients are better within 3 or 4 treatments and side effects. And so we try to make sure we get the greatest efficacy with the fewest side effects.
Candidates for ECT treatments are carefully screened to be sure their heart is stable and that they are otherwise healthy enough to go through the procedure safely. ECT can be done on an outpatient basis, but not everyone can go home the same day. A patient will often stay in the hospital overnight, especially if this is their first treatment.
I felt that I was well cared for. Everything was explained to me well.
When an outpatient arrives for their ECT treatment, they will arrive at the same day center where they will check in.
Almost always we do it early in the morning. And so patients will show up to the hospital around 7:30 in the morning.
I go into the preparation room and change into my hospital gown.
A nurse takes vital signs and an IV is placed on the patient's arm. The anesthesiologist will use this to administer medications during the procedure.
I wait for a little while in the preparation room, and then a nurse comes and wheels me into the post-anesthesia care unit, which is right outside the treatment room. I wait very briefly, and then am taken into the treatment room.
We use a medication to gently relax the muscles in the body so that you don't get that physical movement.
The relaxant lasts only a few minutes, and during this time, the patient will need help with breathing.
And then we give oxygen, so we make sure that the patient has all the oxygen they need through the procedure.
We're just going to give you some medicine to make you real sleepy. All you have to do is just keep taking those nice big breaths all the way in,
and all the way back out again?
Once the team is sure that the patient is completely unconscious and will feel nothing, the procedure begins.
And the treatment involves 2 electrodes, essentially, that we put at different places on the scalp. Electricity passes from one to the other. That then causes the seizure. The seizure lasts anywhere from 30 to 60 seconds in most cases.
The doctor reads the EEG tape to ensure the seizure was long enough and strong enough.
The amount of electricity actually used to cause the seizure is very low. You could be touching the patient anywhere on the body and you would not feel a thing.
When the doctor is satisfied and the treatment has caused an adequate seizure and the seizure is over, the patient is wheeled into the recovery area.
About a minute or so later, the patient's breathing on their own. 10 to 15 minutes later, they're awake, typically oriented, and then in another 30 to 60 minutes, they are able to leave the hospital.
Often, people are groggy and confused from the treatment and the anesthesia, so those who are going home the same day need to arrange for someone to drive with them. These effects will wear off quickly.
After my treatment, I feel as though, the heaviness has been lifted.
A patient usually needs to have 4 or 5 treatments before they start feeling better. Family and friends might very likely see improvements before the patient notices a change.
I didn't notice an improvement in my mood for, I think, at least till the 2nd or 3rd treatment, and then I noticed a small improvement, and then a much larger improvement after that.
But for Dr. Richard Nordgren, he noticed a difference after his first treatment.
Really did make a big difference. It sort of snapped me out of my symptoms.
ECT does not necessarily cure mental illness once and for all. A new episode of depression may come along and require separate treatment with therapy, antidepressants, or ECT.
Knowing that this works very quickly for me and completely, that it's just a great treatment option.
ECT has one important side effect that patients and families should consider carefully.
Some patients will have short-term memory loss around the time of ECT, so have a hard time remembering things that happened, say, between treatments. Some patients will have memory loss for things that happened to them in the past, and so some event they went to that they used to remember very well, they may not remember it as well as they used to.
These memories may or may not return. Some additional common side effects could include headaches, nausea, and muscle aches, though these can be typically managed with medication given during the procedure.
What really matters is I feel reconnected to life. I feel like getting up and doing things and seeing people and just generally being active and social.
Electroconvulsive therapy is an aggressive treatment recommended when other treatments haven't worked or when a patient needs immediate help. ECT has brought relief to hundreds of thousands of people, and it saves lives, preventing suicide and self-neglect. Improvements in anesthesia, muscle relaxants, and state-of-the-art equipment have made it a safe procedure and have reduced the degree of memory loss. Patients recover quickly, and ECT does not cause brain damage or change personality.
For someone who would be looking into ECT but still wasn't quite sold on the idea, I'd have them definitely talk to their doctor and
Ask a lot of questions and listen to the answers and talk to people who've had it.
With ECT, you often see 100% improvement, and that's extremely gratifying to sort of be able to get somebody from very dysfunctional, not able to work, hardly able to get out of bed, to back to, I want to go back to school, I want to go back to work, I feel fine.
No. So what do we do first, right? Primarily, I want to make sure, anybody ever had a procedure done, right? Where you have to go under anesthesia, like even a dental procedure, like you have to make sure this all happens first. Right? You have to make sure that you're healthy, your heart is healthy to actually undergo anesthesia. Most of the side effects from ECT are because of anesthesia. They're not from the actual ECT itself, right? Why do you get a headache? Why do you feel nauseous? It's because of anesthesia medications. So what we do is we pre-medicate you so that we are trying to prevent any kind of headache or nausea that can happen. Now, if you all ever have had a terrible root canal done, right, at the dentist's office, it's pretty nasty, right? And so then you're kind of groggy when you're waking up from anesthesia, and so you need somebody to drive you back and forth. Because you've come out of anesthesia and we don't think that you're safely going to drive yourself when you're drowsy. Same concept here, right? You're coming out of anesthesia, so we don't want you to drive yourself back and forth. We want somebody to actually drive you just so that you don't have a crash or some other event, right? And the most important thing is informed consent, right? All these things have to be explained before somebody even consents for ECT. So of course, this happens a lot, right? Especially on the mental health unit. If an adult is extremely psychiatrically ill to even make decisions for themselves or about their care, we sometimes go to court. We petition the court, and then a judge makes a determination based on the facts available whether ECT is appropriate or not. So what happens during ECT, right? You guys saw, right? So what do we do? I will show you all the machine. I'll show you all what we do as well. A patient gets general anesthesia, right? So you're fast asleep, and a muscle relaxant so you don't jerk. And then we attach electrodes like I showed you, right? These electrodes actually measure your brainwave, right? They actually tell me whether your brain is having a seizure or not. So that's why they attach these electrodes. Then we stimulate, we provide the electrical pulses, and then approximately a minute at the most is when a seizure lasts, and then a patient wakes up like 5 to 10 minutes after, literally. So to just give you all an idea, right? I just had 3 ECT procedures from 7:30 onwards and 8 o'clock up here, right? It's that fast. And so risks, like we went through, right? Memory loss. In most cases, these memory problems will improve within a couple of months. Now, you're not going to forget your name, right? You're not going to forget your parents' name. You're not going to forget like your kids' names or your anniversary. What you might forget is what you had for dinner last night, right? It's something that is happening during your ECT kind of procedures, right? You're not going to forget like key important things about your life. And in most cases, some of these memories do return back, right? So risk of anesthesia, that's one of the most important things that we actually have to counsel people on, right? Is risks of anesthesia are the main thing that you really need to worry about, which is why you undergo a medical evaluation, which is why you undergo labs and a CT scan before you actually have a procedure. And so we'll get to this too, but do you all remember physics? Anybody remember physics? I hated physics, by the way. Yeah, kind of sort of remember physics, right? Electrical waves are sine waves, right? Sine waves like this. I wish I had a bigger one, right? Electrical waves are sine waves, right? So I literally control every single aspect of this wave, right? I control the size of this one individual wave, right? How long it's going to be. In most cases, it is 0.3 milliseconds, right? Not even a second, not even 1 millisecond, 0.3 milliseconds, right? I control the frequency, this height, that is called the frequency, right? And I control the entire length of this wave. That's how controlled it is. I'm not just plugging something into a socket and zapping you, right? There is true science behind it, right? I'm controlling every single aspect of this electrical wave that is going through your brain for a few seconds. And at most, the entire length is 8 seconds, at most, right? So it is, how it works is 0.3 milliseconds, 0.3 milliseconds, 0.3 milliseconds, 0.3 milliseconds for a total of 8 seconds, right? That's how the wave is going, like each pulse of the wave, right? So it's brief pulses, right? 0.3 milliseconds, 0.3 milliseconds, going on for 8 seconds, right? And I'm controlling the hertz. I'm controlling every single aspect of this wave. So we know exactly what dose you're getting. Now, how do I determine this, right? How do I determine this? Because here's the thing. Every single person has a different threshold at which they have a seizure. Now, there are certain medications. People might have heard medications like bupropion or Wellbutrin, right? Some of these medications actually cause seizures, right? But not everybody who takes Wellbutrin has a seizure, right? It is all determined based on our brain's seizure threshold, right? Not everybody has epilepsy, right? So what is a person's seizure threshold? That's what we determine on their first trial, right? On their first ECT session, that's what we determine with like extremely small doses of electricity to see, hey, at what dose, right? What dose is your brain actually having a seizure? Because I don't want to give you more electrical current than you really need to have, right? That's what we first determine. And then once we know what your seizure threshold is, hey, then I can move forward from there. Now, there are a lot of people who are on medications that can actually stop the seizure. For example, medications like Klonopin, you might have heard of that, Ativan, Xanax, right, Valium. These are all medications that we actually give to patients who are having seizures, in addition to anxiety, right? But if you leave apart anxiety, if somebody's having a seizure episode, we give them these medications, right? A lot of our patients are already on these medications. My goal is to have them cause a seizure. They're on medications that stop the seizure. For example, like Depakote, this also stops a seizure. So what do we do in that situation? We have reversal agents. They act within 2 seconds, right? We give them a reversal agent before, when they're asleep, of course, give them a reversal agent, and then we do the ECT procedure. Because the point is for them to actually have a seizure, not to stop the seizure. Can sort of make sense? Does anybody want to see the machine? Let me show you what I mean by this too, right? Because it's as tiny as this, right? This tiny box. I'm going to break it up front. This tiny box is the ECT machine. It's tiny little box, right? ECT is one of the most cheapest procedures people ever undergo. Now, if you let me give you an example. Again, this is just for interest only, right? All those robots that kind of operate on you cost hundreds of thousands of dollars, right? $20,000 a brand new machine. $20,000, right? So the point is to provide cost-effective care, because the hospital doesn't have to charge enormous amounts of money, right, to people for a procedure, which they probably have to do for somebody undergoing like a robotic surgery, for which they had to shell out like millions of dollars to get. So I'm going to attach this to the electrical current. I promise you, nobody's going to get zapped. Okay, I'll show it all now. Right. So this is the machine. Now it's just performing its internal test, but it's done, right? But if you see, right, it controls how many milliseconds, like I can change the settings. It is all digital, right? It's actually pretty awesome, right? I can change everything. So now on this, for example, each electrical pulse, right now, just for an example, right? Each electrical wave seconds is 0.3 milliseconds, right here, if y'all see it. The hertz is 20. The hertz is this length of this wave. It's 20 hertz, right? And then we go on, it's for 0.5 seconds only. Of course, I can adjust it to like say 5.6 seconds or like maximum of 8 seconds, right? And that kind of tells me a total of 800 milliampere. The total current that's going through is 76 millicoulombs. It is that specific, right? It is that specific. It's not just I'm zapping you with your brain. Now let's see what happens when I hook up electrodes, right? I'll hook them up to myself. I promise I won't zap myself, but I will volunteer myself. I want to be happy. So where do these go, right? It's they're just like, if you've ever had a procedure, there are all these sticky things that they put on your body. The same thing, really. And so where do these electrodes go, right? 2 go on my forehead, and 2 go behind my ear, on this bony protrusion that you have on your ear, right? That's where they go. Now, what do these electrodes do? They are measuring my brain waves. That's what I want, right? I want to see the brain waves so that I know what the seizure is going to be like, right? And when the seizure stopped. Sorry, this is entangled. I'm not very organized. Okay, so one of these goes behind my ear, right? Other one goes behind the other ear. One on my forehead with the sticks. On the other forehead, right? And this is my grounding lead, right? So for people who love physics, this is the grounding lead, right? Yeah, so just let's wait for a couple of minutes and you'll see. Oops, it's falling apart. That's why I should sleep. And you'll see waves coming up. Right? That is my baseline waves, right? These are my brain waves. You guys are seeing my brain waves right now, right? And so what happens when the brain waves come on, right? And the patient is under anesthesia, sleeping, right? Muscle relaxant. I take these 2 paddles, right? 2 paddles. There's some gel on it so that we can. And so the way we do it is one on your right temple, one on the side, right? Right temple, one on the side, and then you give a current. Now that has shown significant decrease in memory loss. This kind of procedure, right? For people chronically sick and who failed that, we do bilateral, right? On both sides of the temple. This is probably what most people associate one flew over the cuckoo's nest with, right? But if you see the way I'm moving, the minute I move, that also changes, right? So we want to be able to see. So once I do that, and then it's just this button I press, and I deliver the shock, I deliver the seizure, and it's done. So, and I have brought, from today's ECT actually, I brought a couple of readings so that you guys can see what I'm actually talking about. Yes.
It would only be one delivery.
Yes. Yes, at a time. Each session one shot deliberations.
For no more than 8 seconds.
Yeah, no more than 8 seconds. So let me show you all this, right? So this is an EEG reading from this morning's procedure. This black thing was a shock, right? This was the amount of time I gave the stimulus, 2 seconds, right? This person needed 2 seconds. We were trying to find out at what electric level they have a seizure. 2 seconds, that's all it took, right? And so now you see, I might just go from place to place. Now you see, you're clearly seeing, even if you don't understand medicine, right? Clearly seeing something's happening, right? Something clearly is happening. This is not okay, right? This is the seizure. Seizure has completely stopped. Look back, right? Completely stopped. So it takes longer to bring them into anesthesia and out of anesthesia than it takes for the actual procedure, right? So what happens? Like, why does this work? You know, do we know why it works? And so for that, my analogy truly is, how many of you all have this? I hope everybody has one of these. Right? So what you'll do when the phone has a glitch, mine always does. Like I drop it 20,000 times, right? Then it stops working, right? What do you do? What's the first thing you do? I would shut it off and shut it back on, right? I will reboot my phone. That's what I kind of use to give the analogy, right? What does ECT do? It's causing a reboot or reset of the brain. Same way like you're resetting your phone, right? That's the best. Do we know how it works? We really don't, right? We have theories, right? We have multiple theories that have been studied that have shown, like, what do you call it? Significant evidence that this is why it might work. And they all have to do with neurotransmitters, right? They all have to do with neurotransmitters. So sometimes this electrical current actually causes GABA, the neurotransmitter GABA, and the glutamate concentrations to kind of increase and start making you feel a little bit better. This is the other hypothesis, right? Anticonvulsant hypothesis. So the more people have a seizure, right, even in epilepsy, right, the more often they have a seizure, your brain's response is protected, right? Your brain doesn't want you to have a seizure, right? So your brain slowly adjusts to increase the seizure threshold to prevent you from having a seizure, right? So now it's kind of the same hypothesis for ECT, right? When you get ECT, your seizure threshold slowly increases, and that might be providing you with some depression relief. And the other thing, so what are the uses, right? Depression, one of the number one treatments for depression, extremely safe in pregnancy. It's actually safer than MMS in pregnancy, completely safe. Number one treatment in pregnancy. Not Haldol, not Prozac, not Zoloft, ECT. Number one treatment in pregnancy, right? Very extremely minimal risk of placental abruption, but that's about it. Nothing gets transmitted to the child, none of that. Extremely safe in pregnancy, right? And actually, of course, treatment-resistant psychosis, we use that a lot. Catatonia. So catatonia is where a person is standing, like not moving, not staring for hours, not eating, not sleeping, right in one position. We've had patients that, one of the patients I did today has significant catatonia. So there was one day I walked into the inpatient unit at 8 o'clock and she was staring at the wall, right in one place. I was going for lunch, same place, staring at the wall, right? And then in the afternoon when I came, staring at the wall, same place, not moved an inch, right? not eating, or that's catatonia, right? That's not normal. And so number one treatment, right? So now that patient did not have the ability to consent, right? If she's just standing there and staring at the wall, she clearly does not have the ability to understand the risks, benefits, side effects of accepting the treatment or declining the treatment, right? She truly has no clue. So we had to go to court. We had to petition the court for it. And so when we petition the court, what happens is there is an actual court hearing. The judge is there, you have a public defender, a prosecutor, right? So the prosecutor represents us, and the defender represents the patient. Everything that you see on television, take an oath, all of that, they put you on the stand, they cross-examine you, all of that. And after that, the judge decides, hey, yes, whether to grant the request or not to grant the request, right? And in her case, the request was granted because, yeah, she was going to take care of herself at all, right? One of the other latest uses that we've seen now, of course, this is going to be more and more important as things kind of progress, as our population ages, is dementia, right? Now, is this going to cure dementia? Absolutely not. Absolutely not, right? Right now, we do not have any cure for dementia, right? However, I'm not giving it for dementia. A lot of times, people who have dementia become extremely physically aggressive, like very, very physically aggressive. That is why we have a geriatric psychiatry unit, right? The unit is not because you have dementia, right? The unit is because of the behavioral disturbances that you have because of the dementia, like some psychosis that you might have, or physical aggression that you might have, right? And so ECT has shown to decrease the aggression in dementia. It's not going to cause it to get worse. It's not going to cause it to get better, the dementia itself, but it will definitely help with the aggression component, right? Because that's what I want to prevent. I want to prevent this person from harming themselves or others accidentally because they don't know what's going on, right? So that's why we use it too.
Postpartum depression.
Yes, we use it in postpartum depression too, but primarily with postpartum depression, there are so many other avenues, right? Mothers can choose to not breastfeed their child if they're worried about medications passing through their breast milk, right? So a lot of postpartum moms do not want to go through ECT, and I completely understand that, right? But that is a very viable option, right? Because it does not pass through breast milk. It's very safe, and so that's why I highly recommend ECT for anybody who's pregnant, and so because it's the safest treatment I have. Truly. Any questions? I'm free to field all of them. Yes. Hi, how are you?
I'm good, how are you?
Are you gonna come back?
We'll talk later. What's the youngest? Is it just 18? Or
I would only consider younger than 18, like older teenagers, right? As
Yeah.
close to 18 as you are. For the simple reason is I don't have enough studies. There are some done that are done in like teenagers. And again, their brain is developing, right? So I don't want to zap your brain for no reason. Unless like 17-year-olds, I've had some 17-year-olds that I have unfortunately had to give them to because they had catatonia, right? They might have had first break psychosis. They might have done some synthetic drugs, and none of my medications have been working. Like I've tried 3 or 4 medications, and they're still not coming out of that episode, right? At that point, I have to determine, hey, this is life-threatening at this point, right? When they're not eating, when they're not drinking, despite multiple medications, right? When it becomes a question of life-threatening, yes, I absolutely have used it. But that's older adolescents. I've not used it below. And even with that, me and Dr. Arshad, who's the other child psychiatrist, we will both evaluate the patient separately